Scanning the room.
Hi, my name is Joyce Jones. I'm an ADN student here at Wilson State College, and today I will be demonstrating blood administration. So to get started, I'm in the med room, and I'm just going to start by verifying my healthcare provider order. So I have Samantha Lewis, 6/10/1975, and the provider has prescribed a blood transfusion, 2 units of packed red blood cells now, and an H&H 1 hour after the transfusion. I have verified that my client has need for this transfusion due to her low hemoglobin, and I'm just going to gather my supplies and enter the patient's room. So I have my normal saline, my blood tubing, and a flush. Okay, so knock, knock, knock. I enter the patient's room. Hi, Samantha. I'm just going to verify your name and date of birth. I have Samantha Lewis, 6/10/1975, and she has an allergy to codeine that matches my healthcare provider orders, and I'm just noting that she has on a blood band for her cross match. So also before I entered the room, I noticed that they had the lab results in for her cross match, and she is B negative, and that matches her band. And so Samantha, the doctor has prescribed a transfusion for 2 units of packed red blood cells. Did he come in and speak with you about that? She said yes. She has no questions. So I'm just going to give her a pamphlet of information about what the doctor spoke with her about and get her to sign consent forms for the procedure. So they have been signed. I'm just going to put these to the side so that I can chart those later. And so Samantha, during the transfusion, if you're feeling any symptoms, like shortness of breath or back pain or itching, dizziness, and you need to let me know right away so I can stop the transfusion. And so now I will just go ahead and check her IV site and confirm that that is an 18 gauge needle, because I know I need that for her blood transfusion. And so I have flush, and so first I just assess the site, and I don't see that there's any swelling or tenderness or redness. Okay, and I'm just going to go ahead and clean this, making sure that the clamp is open. Let that dry. I'm going to go ahead and flush, noting any pain or tenderness that the client is experiencing and just feeling for any infiltration or anything like that. And that looks fine. It's flushing just fine. So I will go ahead and lock that back. Okay, and so now I'm just going to go ahead and do my normal saline, just to go ahead and have that ready for the blood administration. So I know I need a 250 ml bag of normal saline because it's the only one that's compatible with the blood. Okay, just going to make sure that all my clamps are closed to start. Okay, we would do the med checks normally, but for the sake of the video, we're not going to do those. So we'll just pretend like we did all 3. Oh yes, and I also gathered vital signs from my client before, just to get a baseline vitals for them before blood administration. So now I'll just go ahead and prime this. So just making sure that all of these are closed once again. Okay, and I'm just going to go ahead and open this one and fill my drip chamber about halfway. Okay, that looks good. So we'll go ahead and prime and get all of the bubbles out of the line. Okay, I want to make sure to keep this in sterile Okay, and there's no bubbles in my line, so that looks good. I'm gonna go ahead and recap and put this up here just so that it can stay sterile and not dirty. Okay, so now that that's done, I'm going to change my gloves. Let her know that I am going to the blood bank to get the blood, and I'll be right back to start that infusion. So, okay, I'm in the blood bank, and I'm with my med tech, and I'm just going to verify that the blood matches up to Samantha, and the blood is compatible. So I'm with the med tech, and I have Samantha Lewis. Her blood bank ID is AFN 3889. The donor number is 120708. We have Samantha Lewis, 6/10/1975, and the sample was drawn on 11/1, cross-matched on 11/16, and it expires on the 30th. So we have B negative, and I'm just going to check her wristband to make sure that that is accurate, and we have AFN 3889, which matches both of these. So the med tech has verified that with me, and now I will just take this to the client's room. Also, I just noted that the integrity of the blood is intact. It's not clotted or anything like that. So now I'm going to go into the client's room, knock, knock, knock. Hi, Samantha. Provide privacy, and I'm just going to do a second check with a nurse at the bedside. So once again, we have Samantha Lewis, 6/10/1975, and that matches up with her wristband. Okay, we have the blood bank ID, AFN 3889, donor number 120708, and it's B negative, which also matches up with her wristband. And so can the nurse just verify that for me?
Yep.
Okay, great. Okay, and so now I will go ahead and start with the administration of the blood. So we know that the blood needs to be hung 20 minutes after getting it from the blood bank. Oh yes, so before I do it, I'm going to do a third check by myself without the second nurse, just to verify and make sure that everything's in order. So I have Samantha Lewis, AFN 3889, donor number 120708, birthday 6/10/1975. It expires on the sample was drawn on the 1st, cross-matched on the 16th, and expires on the 30th. They are both compatible, and they are B negative. And once again, that matches up with my client's wristband and her green band. So now I will go ahead and prime this tubing with blood. So I want to make sure that all of these are closed. Okay, perfection. Okay, and I'm just going to go ahead and spike this back. So, okay. Okie dokie. Okay, so I want to just double check again that my normal saline is closed. And I have, I'll go ahead and open this clamp. And I want to make sure to fill the drip chamber up above the level of that filter when you're administering blood. Okay. And now I will just open this one, making sure to keep this clean so I can recap. And I also want to be sure that I don't waste any of the blood products, so I'm going to do this really slow and go ahead and prime that tubing. Okay. And now I will put a cap on this just so that I can clean the site before I administer it. Okay, so I'm just going to get my alcohol wipe ready. Let that dry. Did I close that clamp? Yes, I did. Okay, making sure that clamp's closed. Okay, I'm going to go ahead and hook that up. and open this clamp. Now that I have started it, I'm going to go ahead and get a new set of vitals. And I will sit with my client for 15 minutes to just note any adverse reactions to the blood. I want to make sure to set my drip chamber at 15 to 20 drips per minute. And like I said, I'll just sit here and monitor the client, make sure that the blood goes in within 1 to 4 hours of administration. And once I realize that she's not having any adverse reactions, I can go ahead and up that drip to get the blood in. And then, so now she's finished. And I'm going to go ahead and do a third set of vitals. And then I'm going to go ahead and discontinue this infusion. So I would take, after stopping the infusion, I would take a stopping set of vitals for Samantha, just to make sure, she's not having any adverse reaction. I'm going to, before I do that, I'm going to flush the tube with normal saline before I stop, just to make sure to get all of the products out and make sure she gets the full amount of her transfusion. Okay, and then I would get her stopping vitals after discontinuing. So to throw this away, I would just put it in a bio bag, and I would document the blood, the type. I would also note the time and make sure to call the lab so that they can get the H&H in an hour, so that they're aware of that time. And then I would document the type of blood, Samantha's reaction, all the components that are on this form, and that is it.